collected. So I want you to know that we're just not building cool things. We're actually curious, do the students benefit from it? So we presented this data in 2018 at ELC, and we asked the students, how are these apps helping you? And as we're doing some of our lit review, I thought it was really relevant to think about this comment that came out of one of the articles. The implementation of technology can enhance learning by making the classroom more active and student-centered. The last 6 months or so, I've been working a lot in trying to make some of the case studies that we built into the cardiopulmonary app and the GATE app into really interactive exercises that you can run with your student real time in the class. Or if you are remote, that you could actually discuss it online. So meeting students at their level of comfort with technology can be the key to the whole puzzle. I really keyed into this idea that you can't just say, guys, you're going to get this app. It's almost like giving them McGee and saying, guys, this is your text, or Kisner and Colby, and you are going to learn everything you need to know out of that. I really think the leveraging of this type of technology really works best when the faculty uses it and teaches with it and helps the student become familiar with how to learn from it. Because I have to do that as the developer of the app. I do that every week. When I'm talking about a new body region, I walk them through the app together, because the app has so much information in there that the repetition of the flow of how I am crafting their mind, when they can see it visually in front of them, they then feel comfortable doing it on their own time. They can move into an asynchronous type of learning mode. So it's not, the bigger these apps become, there's really an important place for the faculty to say, hey guys, so open your PhysioU, let's look at this together. So one key interesting thing that I think is really quite fascinating is we ask the students, out of the required and recommended text, what percentage have you purchased it? Well, 80% of the students are essentially buying less than 40% of the textbooks required or recommended. So they're saying, hey, you know what? I'm either going to share or I'm just going to use your notes because I don't feel like that is value for my money. I don't learn well that way. So I think that's something for us to think about as the new generation saying, this is how we learn. So we asked them some questions. When you use the apps, how did it help you? And I'm just going to give you a summary of what they found, what they said, the big things that they said. One is, it really helped with my comfort with mastery and confidence because I could see techniques before, during class, and after class. It also helped me prepare for the clinic. So why would it do that? I think because whenever I'm teaching in ortho, where I have to teach examination, testing, movement analysis, interventions, and therapeutic exercises, all those scattered pieces, I think what ends up happening is that they have a hard time pulling those pieces together and seeing how they're all connected. They're just kind of grasping, right? They're grasping for whatever you're throwing out there. So whenever, even before I teach them these techniques, I always walk them through the app and show them where everything lays or everything lies. They see how everything is connected. And then after that, then they begin to spend time in class listening and learning, but I've already created a framework for how things are connected. They talked about synthesis and learning. It really helps us to pull things together and make sense of things. And then here, clinical reasoning as well, reasoning, development of clinical reasoning. I think that happens because we talk consistently about patterns of rehabilitation related to the clinical practice guidelines. They hear repeatedly that when I say, you know what, some patients come in and they're stiff, they're mobility deficits. So your examination is always going to be tied to assessing their range, looking at their accessory mobility, looking at tissues that might restrict motion, and treating those stiffnesses, restoring range of motion. So as they begin to see these patterns, it begins to make sense more and more because I'm using these themes that are consistent week to week as I move from body region to body region. Here you see they talk about it reduced my anxiety in lab. I like having videos of the techniques. I like to be able to watch them ahead of time before you show me. And they feel more efficient in their learning, and it's helped to develop them as student clinicians. So we're excited to hear that it's beginning to solve some of these issues that we don't quite think about, because our traditional method of information delivery is, it is what it is. You guys come to lab, I'm going to dump a bunch of stuff on you. I hope it all turns out well. And if not, you're going to figure it out in the clinic, right? I mean, this is traditionally how the model has been. So what I was going to say here is, in our program, our students get the app, the PhysioU apps from the very beginning, which means they have access to range of motion MMT, to cardiopulm, to ortho, to neuro, all the apps they have access to from the beginning. Which means at any point in time, a faculty member, because usually faculty members are kind of connected through the different classes, they can reference things and trickle cool stuff into the minds of the students well before it's even time for them to actually open their orthopedic class or orthopedic app. So you can imagine, I'll give you a sample of that. I'll give you a sample of that next, but every new class is a new textbook, a new faculty member, and for the students is really just deer in the headlights. I've got to get through this. So I've got to shove everything old off the plate and just absorb as much as I can. I think we can do better, and I think most programs are trying to interlink the different classes better, because I think that makes for better learning. So not all the foundational content, anatomy, range of motion MMT, that should not be disconnected from the conditions and examination and treatment of the common orthopedic or neurologic patients. So I think trying to connect what we often leave as isolated islands is imperative for our students to have a good learning experience.